So I took a look at your son's EEG reading, and this is a very abnormal pattern, a circle right here. I'm noticing some sharp wave going on right here, and it's kind of like a slow spike type of imagery that I'm seeing right here. And this is abnormal in brainwave activity, and this is typically found in patients with Lennox-Gastaut Syndrome, or LGS. LGS is a rare and severe form of childhood epilepsy. Now I know you may be wondering, what is childhood epilepsy? Basically, epilepsy is a disorder that is related to the nervous system that can cause seizures in children. And basically it's like electrical surges activity in the brain, which can trigger how you act and how you feel for a short period of time. One thing about LGS is that it is not just a typical seizures that happen. It's multiple. You can have multiple types of seizures. For example, you can have tonic seizures, you can have atonic seizures, you can have myoclonic seizures as well. As this is very rare, only 1 to 2% of epilepsy patients have LGS, and this can occur between ages 2 and 8. Unfortunately, this can extend to adulthood. So it doesn't really stop because since it is a form of childhood epilepsy, it still carries on to adulthood. So some symptoms of LGS are, like I said, having multiple seizures. These seizures can occur daily, and for most patients it's frequent, like it can be multiple times a day. Another symptom is slow development, which can cause delays in the motor and physical skills, and mental and physical motor skills can cause delays there. And also some learning challenges. You may not be able to learn as fast as the other kids or as quickly as the other kids. Another symptom is obviously an abnormal EEG, abnormal brain activity. Now, one thing to this syndrome is that there's something called drop attacks. Drop attack is basically when you have a seizure, and seizures typically affect the brain and the body, and usually when you're having a seizure you don't have any self-control of what you're doing, so your body sometimes tends to give out and just collapse or drop. Usually when it's such a sudden drop, it can cause very serious physical injuries. So this is why when you're dealing with someone with LGS, you have to be very, attentive to them to make sure they don't hurt themselves. Which is why typically with LGS patients, we do have them wear helmets, to protect their brain from any, physical injuries. Now, unfortunately, to this syndrome, there is no cure, but there are treatments that you can do to help manage with LGS. One thing I can say is that with this syndrome, it is very difficult to treat, but it's not impossible. First thing, you can try medications. There's different medications you can try. You can try sodium valproate, you can try benzodiazepines, you can try toprimate, you can try lamotrigine, and many more. Also, you can try some refractory cases. Sometimes when you do dietary therapy, like certain diets, because sometimes with some patients, certain foods can trigger the seizures, so doing certain diets like keto diets or a modified Atkins diet can help manage them too as well. And also a rare option option that people do is epilepsy surgery, which if you have the money for it, as it is really expensive, you can, but it is highly dangerous and you're taking a big risk. And that's all I have for you today. If you have any more information, I have some papers that you're looking for, and I will see you on your next visit.